I'm Nancy Brown, CEO of the American Heart Association. This stroke month, I'm honored to be joined by Senator Ben Ray Luján of New Mexico, a stroke survivor and a champion for equal access to rehabilitation for all people who have suffered a stroke. Senator, thank you so much for being with us. You suffered a stroke in February 2022, and since then, not only have you made a remarkable recovery thanks to the care you received, you've used your very influential platform to inspire millions of people nationwide about having the chance to live a quality life following a stroke. Tell us what Stroke Month means to you.
I was very proud to introduce a resolution that was overwhelmingly supported by the United States Senate, designating May as Stroke Awareness Month. Especially with my experience, waking up with signs that I didn't know much about before, but I knew that I didn't feel well. And it was through conversations with loved ones that happened very quickly that I was told, you need to go see a doctor, get to the emergency room right away. As I've learned, minutes are on your side. And then lastly, doing everything that I can to encourage the Congress to provide more research through the National Institutes of Health to ensure that stroke research is getting and heart research is getting what it needs to help more people. Almost 800,000 people a year have strokes. It shouldn't matter where you live. Life-saving technology should be available to one and all. And I'm committed to keep pushing and advocating and fighting to make that happen.
Early recognition of warning signs and getting to the healthcare system by calling 911 is so important. And, Senator, I am recalling very fondly that you joined us at the International Stroke Conference, which is the world's largest gathering of stroke scientists and clinicians. And you spoke passionately about health equity, and you spoke emotionally about your care team. Why was it important for you to recognize your care team, and how do you think that we can be even more proactive in making sure that people in underrepresented communities get the care that they need?
Our care teams are heroes in our communities. They've committed their lives and sacrificed so very much to care for others. And that's why I think we should acknowledge our caregivers more and more. We don't see them unless we need them. They're your brothers and sisters, your moms and dads, your kids, your neighbors, classmates, and we should thank them, whether we're in their care or maybe we're at the grocery store, just to say thank you.
Our government does play such an important role in reducing the nationwide burden of diseases like heart disease and stroke. You've talked about research funding. What else could we advocate for and expect our government to do to help us reduce the burden of cardiovascular disease?
We should demand funding to expand education. I did not know those early signs myself, but the more that we can encourage friends and family to learn these symptoms and signs, this should be a tool available, but it takes money. It takes investment. That alone will help save lives by itself. In addition to that, expanding capabilities at facilities across the country. Those kinds of investments are life-saving. And extending that capability to rural communities, and then pushing the NIH with real money, real investment to further the research when it comes to heart and brain health. It's going to be critically important. And so I'm committed, but we should all push together to make this a reality.
Thank you for being such a vocal and passionate advocate for our work and in support of other stroke survivors and persons who may be at risk of stroke. Are there any final thoughts you'd like to share with our listeners and viewers today?
Just to say thank you to everyone across the spectrum within the Heart Association, all the neurologists, the surgeons, the primary care physicians, the therapists, the nurses, everyone that prepares meals when you're in the hospital or keeps the rooms looking good. Just thank you, because you saved my life. And I want to make sure that we're doing our part to help you save more and more lives.
Senator, thank you again so much. Your passion comes through with each and every one of your words. It's an honor to know you. It's an honor to work with you. And I know we'll continue to do great things together during Stroke Month and throughout the year.